I'm a doctor, and I would like to show you what the life of my colleagues who are still at the bedside looks like. This is the typical way in which doctors in Germany communicate with one another. It's largely unstructured, printed documents, sometimes faxed. In the more sophisticated cases, these documents travel with a modern technology called fax to PDF. Even small hospitals will have a stack of 10 to 15 centimeters worth of documentation every day about patients that have been sent to them from other hospitals. Around a third of a doctor's time in Germany is spent on documentation, and it is often cited as one of the main reasons why people are interested in leaving the bedside and leaving the healthcare system, or at least their job, after they have spent years and years and years training really hard to get where they are now. One obvious solution is generative AI, right? It can help you make sense of these things and summarize them. Except that there's a problem, which is that in 50 to 82% of the cases, even an advanced LLM will perpetrate an error that was in the original document, of which there are quite a lot, because doctors do make mistakes when they write these things. They might forget something, mistake something, copy and paste from somewhere else. So in up to 82% of the cases, the AI will keep the mistake, but it will make it sound more compelling. So what we used to know as the garbage in, garbage out problem is now the garbage in, beautiful garbage out problem. And this is where we come in with aiomics. So we have created a multi-agent approach to, first of all, fact-check any information on a patient to do a cross-check, quality assurance to see if there are contradictions, if things might not be granular enough, etc. And we present that to the human doctors so that they can make a better informed assessment within a really short amount of time, because they don't have time. And once we have that, we can use that data to save them a lot more time in many other areas. So this could be admission documentation, making sure that they comply with all of the criteria that the insurance expect of them. And this is actually picking up a lot, because there's a new law here in Germany that has been passed, which will double the audit rates in which insurance companies can actually audit the invoices sent by hospitals. They expect that 9 billion euro will flow back just in clawbacks to the insurance companies, but also nobody, neither the hospitals nor the insurers, have the money to hire enough medical controllers to take care of all of this. There's also not enough people on the market for that, and many hospitals are very, very afraid that it might lead them to bankruptcy because they already don't have big margins. So this is one of the biggest tailwinds that we are seeing right now. We are live and paying in different hospitals, including in the last stages of a larger framework negotiation with a really big group, which would lead us to 1 million in annual recurring revenue only for our admission management tool, which is really important because pretty much a lot of the payer compliance tools work at the end after everything has been done. But if you really want to make this happen, you have to make sure that the sword is sharp before you have to draw it, which means that before the patient even has been admitted, you have to make sure that you have all the evidence you need to justify an admission, for example, to justify a treatment. And everything that happens downstream, the entire care quality of interdisciplinary teams, of your discharge management and so on, very much hinges on the quality of the first few hours of the admission of a patient. And that's our core, that's the tip of the wedge with which we are currently entering this market. This is where our fundraising comes in. We had our first round with Vorwerk Ventures, with Norskin Evolve, and with Calmstorm, among many others, also great individual angel investors that are extremely supportive. I am joined by a physicist who's been doing machine learning, data science, and so on for well over 10 years now, with a lot of engagements in the healthcare space. So one meaningful engagement he had was around pacemaker interpretation with machine learning, remote patient monitoring, which has a lot of other complexities. He's also done big cloud transition projects and very compliant heavy segments. and is joined by somebody he also used to work with, who is a regulatory software expert. With that, thank you so much for your time, for your attention. I know it's scarce, and I look forward to hopefully meeting you in person. Bye.